Hello, welcome again to one of these our videos, educational videos for our patients. And today I'm really excited. Me and my staff are really excited because now we have in our office a up-to-date technology that is called CT scan. The technical name of CT scan is computed tomography. So this is one of the wonderful new instrument, our newest addition to our office that we are really proud of. So one of the purpose of this video is for me to educate our patients on how this technology can add value to patients' experience in our office. So traditionally, when you come to our office or any dental offices, there are three kind of different X-rays that patients can get. The first is called periapical X-ray, or these are the two-dimensional X-rays. Typically, these X-rays that we take at your routine checkups and cleaning appointment, and they more focus on one or two teeth. The second kind of X-ray are called panoramic X-ray. Now, panoramic X-rays, they are again a two-dimensional X-ray, and they focus on both the jaw, the top jaw and the bottom jaw. We can get both the jaws in the one X-ray. Now, those panoramic X-rays were considered to be the gold standard for extractions, that is wisdom teeth extractions, dental implant treatment, and even for orthodontics. So if you go for braces, if you go for wisdom teeth taken out, they are still considered gold standard for those treatment. Now, for implant treatment, they used to be considered gold standard, but not anymore. That's where this third technology of CBCT or cone beam computed tomography comes in, because this is such a wonderful addition, is that this is a three-dimensional image of our teeth. It gets the upper jaw, lower jaw both separately, or we can get a combination of upper jaw and lower jaw, and it is a three-dimensional image, and it plays such an important role in the planning of dental implant, because when we are putting a dental implant, we want to make sure we stay away from the sinuses, we stay away from an inferior alveolar nerve. There's a nerve that goes in the jaw, and the whole purpose of this is basically when we place the implant, we want to stay away from the nerve, we want to stay away from the sinus. And the traditional panoramic X-rays does not help us in achieving that. We kind of have to do a little bit of guesswork because it's a two-dimensional image of the three-dimensional space, and that is not accurate. Now, statistically, 90% of dentists have been prescribing panoramic X-ray. Only 10% of dentists have been prescribing cone beam CT X-ray. However, the Department of American Oral and Maxillofacial Radiology, they recommend that CBCT is the way to go for any kind of dental implant procedure. So we have always been sending out patients to get the CBCT before we do implants. We used to send them out to the outside imaging center. One of the reasons why the dentist did not have it was high cost of the equipment. With the newer technologies, the cost has started to get under control. It's not as bad as it used to be, and so now it is not as expensive as it used to be before, and we are able to get this technology in our office. Now, we used to send our patients outside to a different imaging center, and they used to take the X-rays. Now it is extra time and cost to our patient. With this in our office, that is, we are able to give the patient the best service right in our office. Now, there are a few limitations to cone beam technique that I'm going to go ahead and go over, and how we have overcome it. To kind of give you a brief history, the imaging or CBCT or CT scan has been originally introduced in the dental and medical field in 1972 by a doctor named Dr. Hounsfield, and it was a groundbreaking discovery. The reason why is previous to that, the patients had to go through invasive contrast dye so that the doctors can find out, hey, this is the soft tissue, this is the hard tissue. But now it's nothing like that. With this technology, we can diagnose very accurately the hard tissue and soft tissue without patients going through this invasive procedure. Now, what are the limitations? Now, limitations for this, number one, is obviously radiation. However, the conventional computed tomography that was done 30-40 years back, it had a high radiation. However, now, because of the advent of digital radiography, the radiation has drastically been reduced. The radiation that used to be that we go through digital radiography, it's approximately 50 to even 90% less than regular radiograph. So that is substantial. Second thing is, as far as radiation is concerned, is the full body radiation. Now, when you go to a medical office, they take a CT scan and they put you through the machine, and it goes through you the whole body. That's quite a bit of a radiation. With this cone beam technique, we have these scanners that go around your face 360 degrees. It goes around for about 36 seconds, just your face, head and neck area. And out of this 36 seconds, the radiation time is actually 5.6 seconds only. And to kind of give you some numbers, the radiation is calculated in microsieverts. So the radiation that you get is 12 microsieverts. That is equivalent to 5 regular x-rays that you get at the dental office. So the radiation is dramatically less. Again, with the advent of this cone beam technique, because we are able to kind of reduce the radiation, the procedure now is more cost effective, and it's not as technique sensitive as the previous computer technology used to be. And so one of the biggest advantage that we have now with this digital computer tomography or digital CT scan is now we can actually go ahead and plan the whole surgery on the computer even before putting a single cut in patient's mouth. The whole surgery is planned. We have the sizes of the implants, everything already put in the computer, and we can go ahead and plan out the whole surgery before even we do anything. So now I'm going to go ahead and take you to our computer and go ahead and show you how we do that. Thank you. Alright, welcome back. So we got the x-ray for one of our patients, and what we have done is we have imported all the digital imaging over here in the computer. Now this is what a computed tomography means. We get different slices of the x-ray of his jaw. So not only it is a two-dimensional image, like this is, it gives a two-dimensional image over here, and over here this is the third dimension. So from this image we can only see the length and the width, but this over here gives us the thickness. So that's why it is called 3D imaging. Now the part that I was talking about, this CT scan helps us do, is the interactive surgery. So we can actually place the implant even before we do anything in the patient's mouth. So it has a database of different implant sizes and shape, and we can go ahead and actually place an implant right now in the patient's mouth in the x-rays, and we can actually find out, hey, if there is any sinus or if there is any nerve that is interfering. We can look for everything right now. So this is an amazing thing to do. All right, so if you see in this image right here, what I have done is I have electronically placed an implant. So this is where I want the implant to be placed. But this is just a two-dimensional image. This does not tell me anything where the sinus is or whatnot. But if I go to this part exactly tells me. So now I have kind of placed my implant right here, and so this tells me exactly how much the length of the bone is. I have calculated the bone, or how far the sinuses are. They're about 15.5 millimeter out. So I've picked up the implant of my choice, And now I'm going to go ahead and see, put the implant over here and see, if I like the angulation and whatnot. And I like everything. It looks like we are going to stay away from the sinus, and implant's going to be pretty much like a slam dunk there, so there's not going to be any problem. So this is one of the biggest biggest advantage that we are having with this electronic surgery. I hope you guys enjoyed this information about cone beam technology, and we are doing a great special right now. The special is that if you come to our office and get the implants done, we are giving away, basically for a limited time only, we are giving away our consultation for the implant at no charge. And again, for a limited time only, we are giving away the scan, which traditionally costs $350, but for this initial time, we're going to go ahead and give away the scan for no charge. So you come in our office, get the consultation done for the dental implant, get the scan done, and we'll give you the pricing, and there's not going to be no cost to you. Thank you, and look forward to seeing you next time at your next hygiene visit. Have a great day.